Hello, my name is Fiora McRae, and I am a second-year radiology resident at EVMS. I am presenting an educational QI project titled Teaching Patient Preparation Prior to Radioiodine Therapy. The authors of this project are myself, Fiora McRae, and Drs. Richard Lucier, Sarah Shaves, and Lester Johnson. Radioiodine therapy is a definitive treatment option for hyperthyroidism. Prior to treatment with radioiodine, proper patient screening and education are critical for good patient care and safety. Discussion between clinician and patient of the risks and benefits, alternative treatment options, and expected outcomes is an important part of informed consent. Given that radioiodine administration is not a common procedure, we recognize the need for development of a teaching tool for ensuring radiology residency trainees have the necessary experience to adequately prepare patients for radioiodine therapy for the treatment of hyperthyroidism. We developed a three-step approach to resident preparation for iodine-131 therapies. First, a didactic teaching conference was created to discuss proper patient screening prior to consideration of iodine-131 therapy, techniques and cautions specific to radioiodine administration, as well as expected and potential uncommon outcomes of therapy. Prior understanding of the details of the procedure was assessed with a pretest before the presentation and a post-test following the didactics conference. We then created a simulation using standardized patients to prepare the residents for a real-life interaction. The simulation was created in conjunction with members of the Centera Center for Simulation and Immersive Learning, with discussion and training of the SP by a senior resident, supervised by a faculty radiologist, using the materials from the didactics lecture. Each resident then had a standardized interaction eliciting appropriate information as they screened the SP for a simulated iodine-131 therapy, followed by obtaining informed consent. Verbal feedback on the simulated patient interaction was then provided immediately to the resident by the trained SP, followed by written feedback on the recorded content by a faculty radiologist. Average results for the pre- and post-test assessment were calculated for each radiology resident class year and across all 4 years of radiology residency. On the pre-test assessment, first, second, third, and fourth year residents scored an average of 64, 65, 48, and 75% respectively, as demonstrated in Figure 1. Following the didactic teaching conference, scores improved to 96, 98, 98, and 97% for first, second, third, and fourth year residents respectively. Scores were also averaged across all 4 years of residency, with an average pre-test assessment score of 63%, which improved to 97% on the post-test assessment as seen in Figure 2. Feedback from SPs indicated that most residents demonstrated an appropriate level of understanding of the important screening information and risks and benefits of iodine-131 therapy. However, omission of some details of the procedure during the SP simulation was identified despite the preparation. In conclusion, development of a standardized approach to educating radiology residents prior to performing iodine-131 therapies with repetition improves resident knowledge. Omission of some details of the procedure was identified during the SP simulation despite the preparation, indicating that a checklist might be a useful tool for a radiology resident when obtaining informed consent. I would now like to take a moment to thank you for viewing my poster. I hope you enjoyed learning about our educational QI project and teaching radiology residents on patient preparation prior to radioiodine therapy. Thank you for your time.